interviewed in a while.
So, hi, my name is Dr. David Midoff, physical therapist, and I am interviewing Jansen. He's just starting out his residency and fellowship. It's kind of a combined program with the Manual Therapy Institute, and he's here to answer some questions. I'll kick it off with some questions. If you guys have any questions, please tune in. So,
Hello.
hey, Jansen. So, tell us what PT school you graduated from, and when did you graduate?
So I graduated from St. Augustine in Austin. They actually have campuses in Florida and California, but the most recent campus they built was built 3 or 4 years ago, which is the one I went to. And I graduated this past April.
Awesome. And so this past April, we're now in September, so it's just been a few months out since you graduated, right?
Correct. I graduated April 17th. I took my board exam April 29th, heard back results on May 5th, and then started looking for a job. I'm currently working in Houston. So
Awesome.
been practicing for about 3 months now.
Cool. Where are you working at in Houston? What setting?
I work in an outpatient orthopedic environment, so we treat anything from high school athletes to typical weekend warriors that train for triathlons or 5Ks or what have you, that will come in that need some type of exercise or joint mobilization, and then also we go up to geriatrics and we get the occasional neuro case, but generally we will refer the neuro cases out to a hospital.
Cool. So do you work with other fellows or people that have OCS or something like that?
Not in the location that I'm at now, but previous rotations that I've been on during school, I've worked under fellows, and then I've worked at two clinics as a technician before I got into PT school, and everyone was a fellow there. And so even before physical therapy school, I knew that was the route that I wanted to go.
Okay. What attracted you to doing a fellowship or a residency?
I think what attracted me is just the further education. You're in an environment where everyone wants to better themselves. They want to become better clinicians in order to treat their patients better. And then also, I feel the more that I learned in physical therapy school, the more I didn't know and the more that I wanted to know. And I knew that all the fellows kind of had that information. They kind of bridged the gap from being a graduate of physical therapy school to actually being a fellow. So I feel like this is a way for me to kind of bridge my knowledge.
Cool. We just had Dr. Such tune in. I don't know. Justball771 join. Hello. If you guys have any questions, please ask. We just talked about what school Jansen here is in and what led him to do the fellowship. So I have some more questions. Nobody's asking questions right now. Hey, how you doing, Justball? Do you have any school loans from PT school or undergrad?
Yeah, so the way that my loans worked out is I worked in undergraduate. I had to take out loans for the last year and a half. And then once I got into physical therapy school, I actually got into a private school. And the only way I was able to offset the price of going to a private school is living with my family in Austin. And I took out loans to pay for the entire private school duration.
Are you okay with talking about ballpark how much debt you have right now?
Yeah, so I have about a house payment in debt. I have about $90,000 in debt.
Okay. And so given that you have that much in debt and now you're starting a residency or fellowship, now are you taking on that cost for the fellowship right now, or is your employer helping you out?
Well, so I'm taking on the cost, and what I'm doing is I have federal and private loans, and you can enter a deferment rate. And so what I did is you fill out applications for both of them. I was able to defer my loans further for another year, just so I can pay for my fellowship out of pocket. And in the meantime, the money that I'm saving from not paying the loans, I'm just going to save up, and I'm going to use that money to pay for classes after the year is up.
Okay.
Of deferment and loans.
Cool. And so how do you feel going into that situation? Obviously you think that doing the fellowship program is worth it right now? I mean, you didn't wait. You're just a handful of months out of PT school.
Right. Yeah, I mean, I feel like it's more money, obviously, but I feel like education is invaluable. So I know that being close out of school, I'm still, like in the school mindset, I'm still ready to study. I'm still ready to learn. So I feel like this was the best time to do it. And I mean, money's tight right now just because of loans and, further schooling. But I think, again, that it's gonna better my career. It's gonna, open up doors further down the line. that I wouldn't be able to get into without this.
Yeah. Hi, I'm McKay. And there's a few other people that joined. Sorry, I haven't been able to say hi to everybody. Just to update everybody, Jansen just talked about he's got $90,000 of debt. He deferred his loans. He's in order to be able to afford doing the fellowship right now. He really thinks that it's a wonderful program for the skill set that he's going to gain. He's seen other therapists that have gone through this fellowship program. What's the name of the fellowship program that you just started today?
So I started Manual Therapy Institute. It's a fellowship in orthopedic manual physical therapy, and it's out of Texas State and San Marcos, Texas.
Mm-hmm. Yeah, and I'm about to finish the program myself, and so I am doing the program out of Texas State as well. They just rent space at Texas State University, but it's actually its own program, the Manual Therapy Institute. They have locations all over the nation that they teach. Just a side note.
And actually, so one of the clinics that I worked in before going to physical therapy school, David worked at, there was 4 therapists there that were all fellowship trained. And so I really enjoyed the environment. I really enjoyed how knowledgeable everyone was about what they were doing. And I noticed that there was a difference in their care of treatment, or their quality of treatment, versus other therapists that I'd seen in the past. So that was another reason why I decided to go down this road.
Cool. Did you watch Saved by the Bell? Not sure what that what that question is getting at exactly. Sorry, I don't know how to. Maybe you can clarify.
No,
whoever.
I have not watched that. I'm hoping they're not saying that I look like Screech or something.
Oh my gosh.
No, I caught a few episodes, but I never fully watched all the seasons and episodes.
Oh, Maddie Joseph said that's their favorite character.
Who? Screech?
I guess so. And now they're saying the X-Files. All right, anyways, that's getting off topic. So let's go back to residencies and fellowship. So today's day 2 of the first weekend course of the Manual Therapy Institute. We're covering foundational information. What's been your biggest takeaway so far for this weekend?
My biggest takeaway? That's a good question. I think the biggest takeaway this weekend is just patient care and showing that you're compassionate and caring, and learning kind of nonverbal cues and really body language on how to interact with people. Just that's a tough question. I think really just kind of leveling everyone and making sure that you can interact with a patient, and making sure that you're taking into consideration their concerns, their ideas, what they think they should have, and kind of molding it into a treatment approach, I think is the biggest takeaway.
Now, what are some things that you've practiced hands-on wise so far? Because this is the Manual Therapy Institute, so obviously there's manual therapy involved. Could you tell us what you've practiced so far?
Yeah, so we've practiced palpation of cervical and thoracic spine. So I know that the program that I come from, we hit that in depth, but it's really good to go through everything again. Like the instructors were saying, this is kind of the first couple of classes are leveling classes to make sure somewhat that everyone's on the same page. And so we're covering some basic palpation, but it's good to go through just to make sure that we're on the right spots and we're feeling the right things, and that we can check that with like you're in your 3rd year or your 2nd and a half year, or like a fellowship trained instructor, to make sure that we're actually feeling what we're feeling.
Good. Dr. Such had a question asking, what made you decide on MTI, the Manual Therapy Institute, versus other programs?
So the program I come from is also very heavily based in manual physical therapy.
Which one is that?
I come from St. Augustine, and so the president of St. Augustine is Stanley Paris, and his wife is Dr. Patla, and they both have a lot of research in orthopedic manual physical therapy. They're actually pretty big names in therapy as far as manual therapy. And I did their classes, but the reason that I didn't sit for certification for them is because it's not recognized by the American Physical Therapy Association, which this fellowship is. And also this fellowship requires hours. So you go through 1.5 years of classes, postdoctoral classes, and then you have to do, 440 hours under a fellow, which I think solidifies your knowledge and makes sure what you're feeling is correct and what the treatments you're applying is correct. I think it's good just to kind of have further mentorship after school.
Great. Y'all, if you have any other questions, please chime in. We're just going to go for a few more minutes here, I guess, depending on how many questions we have. Hi, Gillima61. Nice to see you join in. So now, what do you hope to gain obviously you get the designation Fellow of the American Academy of Orthopedic Manual Physical Therapists, FAAOMPT, by completing this program. But aside from the title, what do you hope to gain from this fellowship program?
I hope, so there's kind of what we talked about this weekend is a lot of evidence. So if you treat someone based solely on evidence, you can get 75% of people better. But then there's a 25% of patients that are outliers that I think you need advanced training to pick up a very tissue-specific type injury. And as a new therapist, I feel like I can pick up on some of those, but there's still a lot of cases where I'm kind of left with a question mark. So, I mean, I'm hoping to kind of solidify the last 25% and just really be able to treat all my patients with the best possible care.
Awesome. Now, a lot of people will wait to start a residency or a fellowship. Oh, hold on, we got a pop-up question here before I forget. Can you describe the ratio of time spent at your outpatient job and your fellowship responsibilities? That's a good one.
Okay, so I'm still fairly new. So basically the way it works is I do class once a month, I do 1 week in classes, so it's 8 to 4, Saturday, Sunday. So I'm able to continue working 40 hours a week at my clinic job, and then I come once a month for fellowship classes. Now once I finish the year and a half of classes, from what I understand, most clinicians they'll work 4 10-hour shifts, and then they'll work a Friday under a fellow, just gaining their observation and clinic hours under a fellow, if that makes sense. I know it's kind of a handful.
Yeah, and you know, you're early in the program. I'm just going to chime in real quick here. Excuse me. I'm almost at the end of the program, and so I'm in the middle of finishing my hours. I have somewhere in the ballpark of 330, and I have been traveling from El Paso going to Austin, where I have my mentor, and I do an hour's worth of a week's worth of hours at a time. So I'll get somewhere in the ballpark of 35 to 40 hours for that week, and I just do it in chunks like that. And over the course of about 11 weeks, that's 440 hours, give or take. And I have to just take the hit. So I don't make any money. I have my own practice, and I do some home health on the side, but I don't have paid time off. And when I did work in an outpatient facility, I had to take PTO or take unpaid time off as well. But it's temporary, short-lived, and thankfully I'm all done paying it as well. But back to Jan. This is in his first class, has not started the fellowship hours yet.
Correct.
He's just starting the residency portion of the program, doing coursework.
And I think the coursework is manageable as far as study time. I plan on studying a couple hours on Saturday and Sunday, and then if I need to, maybe like an hour a night. But I mean, I don't think that will be necessary. I think the weekends will be plenty of time to get my studying in.
Good question, Dr. Such. So another question that I was starting on is why did you not wait to start a residency or fellowship versus starting right away? I know there's one of the instructors here, Peter Kroon, he was talking about how some of the requirements for a lot of fellowship programs are that you need to have a residency already. So you need to be like an OCS or something like that, or you need to have so many years of practice out before joining into a fellowship. So why did you jump in right away?
I think being so fresh out of school, I still have the drive and the motivation to study. I'm still wanting to learn. And kind of like I was saying earlier, the more that I learned when I was finishing my doctorate in physical therapy, the more I realized that there's a lot more information out there. And I feel like someone described it to me in a good way. They said finishing physical therapy school isn't finishing a game. That's like the admission getting into the stadium. So I mean, really, there's so much more after finishing physical therapy school. And it's not a requirement for physical therapists to do residency or fellowship. But I really think that makes a difference in the quality of care that they provide. And I just wanted to be able to do that sooner and quicker.
Awesome. Hi, Fantastic Potter. We have people joining in. All right, Dr. Such has another question. How did each of you find your mentors? So Jansen does not have a mentor yet. He's not at that point in the program. You have to go through the classes. Let me just flip the camera here so I can tell you how. Mentoring with a guy named James Harris, Dr. James Harris, out at Austin Manual Therapy. And I used to work at that clinic, and so I already had that relationship. And that's generally how most of the fellows going through the program will go into a fellowship relationship? Is it someone that they know, someone that they met, maybe someone that they were a tech with at some point, like Jansen was a tech at that clinic that I was at, and so they touch base again and ask, hey, will you be my mentor during my fellowship hours? And then there are in some cases as well where there's people going through the program that do not have an established relationship like that, in which case the program directors will try to best match them with available people. It's also location-based, so for instance, I'm in El Paso and I'm unable to do my hours with anyone in El Paso, so I have to travel. Although if I could have someone set up, I probably would stay in El Paso to do it if possible. They're spread out all over the country. It just depends where you're at. And with the Manual Therapy Institute, they make sure that all the fellows going through the program are paired up with fellows, a fellow alumni from the MTI program, because we all speak the same language and have the same training, so it's pretty consistent, and we're not having to change treatment philosophies or catch up and level the language and all the information that we cover. Hope that answers your question. Hi, Freedom Floa. Nice to have you join in. So we're nearing the end here. We got to get some lunch in before the rest of the afternoon class starts. Hello. If y'all have any last minute questions, please ask now. I know Jensen's tummy's rumbling here. He's ready to eat. We got to go practice some more stuff here before the end of the day. Just to give you all a heads up, next weekend I will be back here at MTI in San Marcos, Texas State University, with some students that are a year out from starting. So some of them may have already started their fellowship hours, and I'll see if I can find someone to interview then as well. So you won't see Jansen again. He's just starting out. Maybe we'll catch up with him again sometime here over the next few months, few years, and we'll get an idea for how much better he feels. Which that leads me to another question. So how confident do you feel in your abilities in manual therapy, specifically joint mobilizations and manipulations right now? Because this will be something interesting to check maybe a year out from now or when you're near the end of the program.
Right. As far as the techniques, I feel confident doing the techniques. As far as who to perform them on, I feel less confident, more so just because I don't want to hurt someone doing a manipulate. I mean, even with the, even checking red flags and clinical prediction rules and all that stuff, even if I know someone fits the criteria for a manipulation, sometimes I just don't feel as confident. So I think as far as a confidence level, I'm around like 60% confidence level. And as far as actually doing the techniques, I mean, I feel completely capable of doing all of them that I'm trained to do. I know that I'm going to learn more here that I don't know how to do yet. So as far as doing the techniques, I would feel 100% confident, 90% confident, somewhere in there. As far as doing them on a live patient that needs them, it's more around like the 60% marker.
Okay, awesome. So hopefully that jumps up to like the 90s or 100% over the course of the program, and especially into your fellowship hours. I know I can speak. Let me swap the camera here. I can speak. I'm further in the program, obviously going to finish pretty soon here, and it has been a huge confidence booster doing the fellowship and the residency portion of the program. And I was probably just like Jansen, a few years ago when I started the program, and now I feel really confident with a ton of patients. There's very few situations that I get into where I feel like I don't know what I'm doing here. Whereas that was like half my day in the clinic usually before when I started the program. It's builder. All right, guys, any last questions before we end this broadcast, this scope, as they call it? All right, going once, everybody, going twice. All right, we're done. Thanks, Jansen.
All right, good chatting with y'all.
Sorry, Amanda, please, we just ended. Catch the replay. Have a great day.